Hi, everyone. This is Jennifer Coons, reference librarian at the Haverford Township Free Library, with your July 2nd COVID check-in. Today, I just want to let you know this is going to be my last check-in for a little while. Just trying to figure out how to work out my schedule now that we're going to be reopening and I'm coming into the library. So I'll see how it goes. Maybe I'll meet with you again at the end of the month. We'll see. But today, since this is going to be my last one for a while, I wanted to give you a little bit of a wrap up of what we currently know, talk about reopening and what that means, talk about immunity, vaccines, a little bit of mental health. I'm going to give you a little bit of a diversion about something called harm reduction, which might seem like it has nothing to do with COVID, but can be applied to COVID, and we'll see how it goes. I'm not a health professional. I'm not a government official. I'm not a public health expert at all. I just read a lot. And I look at a lot of information. I subscribe to a lot of health emails. I do, I won't say research necessarily, but I read very deeply, and I am careful about the sources that I consult. So I may make some mistakes, and just forgive me and bear with me as I try to help you understand this situation a little better. So, first thing I want to talk about is reopening. And so, like I said last week, I think, we noticed in last week's COVID check-in, I was talking about the increasing cases across the country, especially along some Sunbelt states. So certain states like Arizona, Florida, Texas are seeing a real increase in cases, not necessarily tied to increased testing at all, because there are increased hospitalizations for COVID cases. Even states like California and Washington, which had been in the forefront of controlling the spread of the virus at the outset, are showing increased cases. The New York Times has reported on June 28th that a lot of the outbreaks are directly attributed to bar and restaurant attendants, which they're calling restaurant clusters. For example, in Michigan, more than 70 cases were linked to a specific restaurant in East Lansing, and the cases were among 18 to 23-year-olds, which might indicate that younger folk are perhaps not exercising as much caution as others. So what else do I have to say about this? International. I'm just also going to go to California for a sec. So I mentioned California as having a real increase in cases, very concerning. And so some of the reasons for this is that they are some of the reasons that the cases are increasing in our country is that we're a large country. We have 50 discrete states that have their own state governments. And then within those state governments, you have multiple localities with their own governmental entities. So this can really make things complicated when it comes to a public health emergency, like a broad worldwide public health emergency. So an example of this can be seen in what has occurred in California. So many Californians, especially in less densely populated areas, didn't see the overwhelming hospital cases. So it's a very normal psychological response if you don't, if you're reading in the news, but you just don't think it applies to you, because you're fine looking around and your neighborhood's fine and everyone around you is fine and your hospitals aren't seeming to have problems. So they didn't think that they thought that reopening, just completely reopening as pre-pandemic norms would be fine, and then they're seeing some rising cases. California is made of a complex patchwork of rules that differ among all its 58 counties. So many Californians were confused about what they should or should not do. And some local leaders decided to ignore the governor's orders and decided to be in charge of their own local reopenings, which confused people. And finally, Memorial Day saw a loosening of social distancing practices. So there were graduation parties, barbecues, beach trips, social gatherings among people from different households. And health officials are actually predicting that they could run out of hospital beds by mid-July. So yeah, and Pennsylvania also, we also have a lot of counties with a lot of different local governments. So we'll see what happens with that. I did want to go back and just talk about what's happening around the world before I get to Pennsylvania. So David Nabarro, who's a special COVID-19 envoy for the World Health Organization, he has noted that the countries that seem to be more effective in controlling the spread of the virus are those that, obviously smaller countries, and those countries that are more or less politically divided. So you've got Iceland, Germany, New Zealand, Japan also has seemed to. It's not that the cases aren't sometimes coming up, but when they come up, they're able to control them pretty effectively. Also, Jeffrey Shaman, an epidemiologist at Columbia University, has also said the countries that are succeeding in, this is a quote, the countries that are succeeding in systematically controlling the spread have been the ones where political and public will unite. So, okay. So now let's go to Pennsylvania. So we're not doing horribly. We did reach this peak in April, and then cases went down quite a bit. So you can't see the months down here, but that's sort of April, May, and now we're getting into June, and they're rising. They are rising a little bit. What you can see here is that one of the problems we have in the state is we don't have enough contact tracing based on how many positive cases we are finding. So contact tracing is really important to control the spread, because once you find a positive case, you want to be able to talk to people and find out who that person has been in contact with over the course of the past few days or week. And you want to contact those people to let them know that maybe they should isolate themselves if they can, that kind of thing. So we're having, we don't have a good contact tracing at the moment. What else did I want to say? Okay. I want to say that, so 142 cases were discovered in a 24-hour period between June 29 and June 30th. So Mayor Kenney has reversed some of his reopening orders. So he's actually reversed indoor restaurant dining, for example. However, I believe that malls and casinos are still open. And then a message was sent out yesterday, July 1st, from Governor Wolf, mandating mask wearing for Pennsylvanians whenever they leave their home. And as far as I can tell, this order will be encouraged as opposed to enforced. So that would mean that if a public health official or law enforcement personnel saw somebody who wasn't wearing a mask, they would approach them and try to educate them on the importance of it, encourage them to wear. So for now, there'll be no fines or citations for people who don't comply. What else? Okay, and so Governor Wolf seemed to think that, similar to other states, that the rise in infections could be traced back to sort of Memorial Day celebrations and people not being consistent with their social distancing, including maybe wearing masks. Okay. One thing I wanted to an interesting newsworthy thing I wanted to share with you is that Philadelphia, this Philadelphia City Council has introduced a bill unanimously that Mayor Kenney also supports, that will protect workers who, if their workplaces if their employers are not instituting proper protections from COVID in the workplace, like maybe so they're not, the people are too close to one another, or there isn't consistent mask wearing practice or other things, or let's say there isn't access to clean water and soap and water and paper towels to wash your hands and all that stuff, that if they call out their employers for that, they will not be punished. They will not be fired. disciplined or legal action can't be taken against the workers. So what was I going to say? So it would provide, so it would make it illegal for the employers to retaliate against workers who called out their employers for not offering sufficient protection from COVID-19 at the workplace. So this would protect nursing home and healthcare workers, home health aides, grocery store workers, port workers, as people who unload and load on the docks coming into Philadelphia. Also sanitation workers, meat packers, transportation workers, like people who work on subways and buses, for as an example. All right. I'm sorry, I have a lot of information here, so I have a lot of pieces of paper here to talk about. All right, where am I? Where am I now? Okay. So now we're going to go, I just want to give you a review of what we currently know about COVID-19. So research is happening every day. Scientists are sharing it. Knowledge is being gathered in real time. Sometimes the information is not like 100% correct, but that's totally understandable when you have a novel disease you've never seen before and you're 6 months in and you're trying to figure out things about it. So here I'm just going to give you some just like random pieces of information that I've gathered over the past 3 months. And it's as current as I can make it. Certain people seem more disposed to efficiently transmit the disease. So these are these super spreaders that you might have heard about. Scientists don't yet know what mechanism underlies this, why that is. Group gatherings have been shown to trigger these super spreading events. So it's large group gatherings among people who are not from the same household that seem to be risky in terms of transmission. And spreading appears to be erratic rather than uniform. Asymptomatic transmission, this is really big because there's been growing evidence and information that's come out over the past month about this. There's been some really important research and reporting in this area. So asymptomatic transmission was probably occurring way before the first US case was recorded. Back in February, a handful of health professionals in Germany became aware of asymptomatic transmission via an auto parts company with cases that spread through the employees of that company. And one case was traced apparently back to a cafeteria interaction where somebody passed somebody's salt shaker. Germany is like, with their contact tracing, they're very, very good with figuring out who was contacted who. So, okay. So although they try to get this information out about possibility of asymptomatic transmission, the broader public health community did not take it into account as seriously, and it wasn't widely reported. So, that is possibly because many public health and government officials knew that the reality of asymptomatic transmission would mean they would have to take really drastic measures, which we ended up having to do in a lot of places, like complete shutdowns. Because if you don't know who's infected, how can you try to control this at all? So more recent research in Italy and the United States has shown that the asymptomatic cases can occur in up to 40% of a given cohort. That doesn't mean that that's a finite number, but that it could be up to 40%, which is pretty significant when you're talking about the possibility of a disease being transmitted by someone who seems perfectly fine and would have public health ramifications, because you need to think about how you're going to be in the world if you're, not just staying away from sick people. Okay, anyway, going on. So the reason I'm emphasizing this is, like what I just said, for thinking about how to reopen economies and communities without overwhelming public health infrastructures and community of the health of the members of the health of the members of the community. And also you can understand why the social distancing and mask wearing can be important when you're aware of this prevalence of asymptomatic transmission. And again, like there's no evidence that's happening. Like this is just initial research and information, but it's important. And a lot of public health officials and epidemiologists are taking this really seriously. So this brings me to another interesting idea, and I want you to bear with me here, called harm reduction. And because it's going to seem like I'm going to take a little bit of a diversion from COVID for a minute. Oh yeah, that was the slide I was supposed to have up when I was talking about what we knew. Sorry. So you can look at that while I talk about harm reduction for a little while. So, okay. Harm reduction refers to, I'm going to move on to the harm reduction. It refers to a way of approaching, for example, drug addiction, especially intravenous drug addiction. And so it's supposed to lessen the stigma, and it's a more compassionate approach. It's instead of an all or nothing approach, it's like, okay, if you're going to use drugs, here's a way that you can continue using them without killing yourself. So that's it. So apparently research has shown, and this, I read an article by a woman named Julia Marcus, who's an epidemiologist at Columbia, maybe it's Harvard. I'm sorry. She's an epidemiologist at Harvard Medical School. I'm getting my professionals mixed up. Okay. So the whole idea of a lot of drug education is abstinence only. And of course that's important. Like if you're addicted, abstinence is incredibly important. However, if you have somebody who's just in the throes of their addiction and you don't want them to die, if it's somebody you love, then harm reduction is a really important way of approaching it. So you're saying, okay, let's make sure you have clean needles so that you're not going to get HIV. Let's make sure that if you have an overdose, somebody can administer Narcan or administer another intervention. And research, it says, evidence shows that harm reduction approaches such as needle syringe programs reduce the health, social, and economic harms of drug use to individuals, communities, and societies. They do not cause increases in drug use. So research is showing that this kind of harm reduction approach doesn't make people want to use drugs more. It actually protects them and the communities. Okay. Yeah. So she says abstinence-only education, this is Julia Marcus, this epidemiologist at Harvard, says abstinence-only education is associated with worse health outcomes. Years of HIV prevention has shown that shaming doesn't eliminate risky behavior, it just drives it underground. So you have this false binary. You either abstain 100% or you engage or use 100%. There's something in the middle where you have lower risk behaviors. So I'm going to apply. So why am I talking about this when we're talking about COVID? So my fourth point here is there's another false binary. So shut down the governments and businesses completely or open up completely. Both of those are going to have poor consequences. So what she says, so Julia Marcus is saying that you can see that each of these possibilities, shutting down completely or opening up completely, don't really work. When you have also in terms of individual behavior, like if you have 100%, you have people who are like wiping down the cardboard boxes they got from Amazon with Clorox wipes. They're washing their hands 1,000 times a day, maybe when they could stand to wash them 50 times a day, or depending on the risk, where they've been. So low risk would be if you're going out on a hike and there are not a lot of people around, maybe you don't need to wear a mask. If you're outside, the weather's humid, it's hot. When you go to the grocery store or another indoor environment where there are more people and the airflow isn't that great, wear a mask. And you hope that other people wear masks also. Lower risk behaviors are more sustainable. Abstinence-only behavior can lead to a binge if you're talking about drugs, or a binge and like, I've been inside all day and I'm doing all this like mask wearing, and I'm just going to say to hell with it and go to a restaurant as soon as it opens and not practice proper social distancing. All right. I wanted to read you. So the end of what she says, okay, so having said that, I want to acknowledge that there are a lot of essential workers who don't have the luxury of staying home, driving to work, need to take public transportation. They're working in indoor environments for long periods of time where there are a lot of people. And I could do a whole additional COVID check-in about how this disease is affecting more vulnerable populations. Not going to go into that today. I'm going to continue with what I'm saying, but I just want to acknowledge that. So I'm talking about people who have the privilege of driving to work and making choices about low-risk behaviors because they have the freedom to do that. All right. So Julia Marcus says, trying to shame people into 100% risk reduction will be counterproductive and can backfire. All or nothing approaches rarely work in any setting. What Americans need now is a manual on how to have a life in a pandemic. If no one else provides the guidance that the CDC won't, each of us will need to figure it out on our own. So we are getting some mixed messages. We aren't getting consistent messaging from different leaders. So I don't want to leave you in that place. So I'm just going to tell you what I'm doing. Again, not a public health professional. I'm not an expert in any way or in anything, but I am a good librarian. So I know how to look at my sources and look at different information and try to make sense of it to give you some ideas. I can also tell you some really great resources to consult about this whole thing. But what I'm going to tell you now is from the reading I've done, from all the sources that I've consulted over the past 3 months, and especially most currently, I'm going to tell you what I do. I'm not telling you to do this. I'm just saying that this is how I am approaching living life in a pandemic. So these are some suggestions based on what I've just said. So 1, given the strong possibility that COVID-19 can be transmitted via people who exhibit no symptoms, it would make sense to keep a safe distance from those who don't live in your house, especially when you're indoors. When you're going to an indoor location where there are a lot of people, it's be good to wear a mask because you may be asymptomatic. You want to protect them also. Okay, so how to socialize with loved ones and friends who don't live in your household. Outdoors is better. Use your judgment regarding distance when you're outdoors. Maybe wear a mask when you're outdoors. So I personally have met friends in backyards and parks. I've gone on hikes with my husband where, for the most part, we don't wear masks if the foot traffic is low on the hike that we're going on. Sometimes my husband and I hike with our adult children who don't live in our household, and some of whom are healthcare workers. We wear masks when we hike with them. I will admit that sometimes I take mine off, even in those occasions, if the humidity is kind of high and we're hiking far enough away from each other. This is a combination of my own thought patterns and biases, and it might be somewhat arbitrary, but I'm just telling you how my mind works and why I do what I do. I don't wear a mask when I walk my dog, mostly because I'm almost always not close to anyone else when I'm walking my dog, even on the sidewalk. So if someone walks by, I might move a few feet away from them. I always wear a mask when I go into a store. I always try to go to stores when they're less crowded. I have the freedom to do that. I also wash my hands when I get home. I don't wipe down my purchases. I don't wipe down boxes when they come, packages that come to my house. I wear a mask at work, except when I eat. And then I go off into a corner that's really far away from, like 20, 30 feet, 40, 50, 60 feet away from people. And I eat without my mask on because it would be really hard to eat with a mask on. Finally, I listen to people in the healthcare field. I listen to respected immunologists, virologists, mathematical modelers, and especially public health officials. I don't know where my other paper went, but anyway, and I try to make up my own mind from what I'm hearing from them. Okay, that's it. Thank you so much for being with me. This is a really long one. I appreciate you. If you're still here with me, thank you for sticking with me. I hope I didn't confuse you more. If I did, please ask me questions. I'm a librarian. I love when people ask me questions. And you can either do that by commenting in the comment section. You can also send me an email, coons@haverfordlibrary.org, and I'll try to answer your question. Thank you so much for sharing this time with me. And maybe I'll see you in about a month. Bye-bye.